Good evening. The coronavirus has infected 166 million people globally. Across the world, 3.45 million people have been killed. After almost a year of alleged cover-ups and obfuscation, the clamor for truth about the origin of the coronavirus is rising. Under intense pressure, Dr. Anthony Fauci, advisor to US President on Health, also sought an investigation into the Wuhan Institute of Virology. 18 scientists have already written an open letter seeking clarity on what was happening at the Wuhan lab in China. We get you that story. Also on India First, will this be the wonder drug to deal with coronavirus? A cocktail of drugs used to treat then US President Donald Trump when he was infected with the coronavirus is arriving in India in about an hour from now. Will this be the magic bullet? Dr. Naresh Trehan is Chairman and Managing Director, Medanta, the Medicity. An exclusive interview on the new drug coming up with Dr. Trehan at 10:30 tonight. I'm Gaurav Sawant. Action-packed 60 minutes. Let's get started with the headlines on India First. After COVID jabs, now a shortage of antifungal drug in Delhi and Maharashtra. State governments say amphotericin B, the drug used to treat black fungus, is in short supply. COVID cocktail drug administered to Donald Trump now arriving in India. The wonder drug developed by a Swiss pharma giant to cost nearly 60,000 rupees a dose can be given to mild and moderate patients. Big boost to India's vaccine drive. Sputnik V to be made in India now. Russia's Panacea Biotech and RDIF to manufacture the vaccines in Himachal's Baddi town. High alert issued in West Bengal and Odisha as cyclone Yas looms over the east coast. The Met Department says severe cyclonic storm likely to make landfall late Wednesday. Was the coronavirus made and juiced up to be more dangerous at a laboratory in Wuhan in China? Questions are rising in different parts of the world. Last week, 18 eminent scientists had written an open letter seeking a transparent, data-based, peer-reviewed investigation. Now, US Senator Dr. Rand Paul has asked Anthony Fauci, advisor to US President Joe Biden, some very uncomfortable questions, including his reported funding of the same laboratory at Wuhan. The question remains, will China come clean on what was happening at the Wuhan Institute of Virology?
No, I'm not convinced.
A major change of stance by Dr. Anthony Fauci, advisor to US President Joe Biden on the origin of the coronavirus. Dr. Fauci now says he is not convinced that the deadly virus developed naturally and has sought further investigation.
I think that we should continue to investigate what went on in China until we find out, to the best of our ability, exactly what happened.
Dr. Fauci is the director of National Institute of Allergies and Infectious Diseases and had initially rejected reports that the coronavirus had escaped from a lab at Wuhan, lending weight to the wet market theory, indicating it evolved from nature and then jumped species.
Even Dr. Fauci now admits that COVID-19 might have come out of a Wuhan lab, not out of a meat market, not naturally, so to speak, jumping from bats to other animals to humans, but rather a manufactured virus negligently let loose by the Chinese through the Wuhan lab.
Started in a lab in Wuhan.
Dr. Fauci and Senator Paul Rand had recently clashed during a Senate hearing over whether the United States had funded a gain-of-function research at the Wuhan lab that made the virus more potent in a controlled lab environment.
Doctors Barrick and Shi worked together to insert bat virus spike protein into the backbone of the deadly SARS virus, and then used this man-made supervirus to infect human airway cells. Dr. Fauci, do you still support funding of the NIH funding of the lab in Wuhan?
Senator Paul, with all due respect, you are entirely and completely incorrect that the NIH has not ever and does not now fund gain-of-function research in the Wuhan Institute
Do they fund
of
Dr.
Virology.
Barrick?
Last week, the Republican members of the House Intelligence Committee released a report saying there is significant circumstantial evidence that the coronavirus originated from a leak at the Wuhan Institute of Virology. A group of 18 eminent scientists from universities across the world have also called for a transparent, data-based, peer-reviewed investigation into the Wuhan lab. Bureau Report, India Today. Dr. Anthony Fauci now says he's fully in favor of an investigation. Is the world increasingly accepting the fact that the virus did not emerge from the Wuhan wet market, but perhaps from the Wuhan Institute of Virology? Will China continue, as some allege, to cover up? Joining me on India First is Dr. Amitesh Anand, scientist and chemical microbiologist at the University of California. He joins us from the United States. Professor Brahma, Chellaney, one of India's foremost voices on China, and Einar Tangen is a political commentator who joins us from Beijing. Dr. Anand, 18 scientists had written an open letter seeking clarity on the research at the Wuhan Institute of Virology. Dr. Rand Paul, senator from Kentucky, says gain-of-function research was on at Wuhan. Is the scientific community convinced that the Wuhan wet market was a bogey and that a probe is a must into the Wuhan Institute of Virology, sir?
That's a great question, and let me answer it very carefully. So, whatever changes that you are seeing in terms of our possibilities about the origin of this virus, we are not saying that there is no. It's not possible that it has not originated from wet lab market in Wuhan. What you are seeing these days, and what we are trying to study more about, is the alternate hypothesis that there is still a possibility that instead of the wet market, the virus has probably somehow escaped or leaked from the virology institute in Wuhan. So it's not that anybody is saying that it has not originated from wet lab. We do not have conclusive evidence to say that it has not. What we are saying that we also do not have enough evidence to rule out that it has not originated or created in the laboratory. And in fact, for the last 5 years, I have been doing work in the field of gain-of-function mutation. I can tell you that it's a very, very likely possibility. We have ability to manipulate viruses, bacteria. I do it on a regular basis. I do it with bacteria in the lab, and we do gain-of-function mutation, where we gain-of-function study, where we try to evolve a microbe in a given condition, and we try to see whether the microbe will evolve to survive in that condition. So the possibility is wide open. Both the possibilities, both the theories are to be studied and examined.
Professor Brahma, Chellaney, former US President Donald Trump and his Secretary of State Mike Pompeo said this all along. Focus on the Wuhan Institute of Virology. Scientists and Dr. Fauci are saying it now. The clamor for truth, is it finally breaking through the allegations that were being made of a major cover-up, whether by China, whether by WHO, Dr. Fauci or Peter Daszak? They were all apparently then on the same side, sir.
You're absolutely right. The tide has clearly turned. It has turned against the earlier assumption that the virus emanated in wildlife and then got transmitted to humans. Now the prevailing perception is that the lab leak theory looks more plausible. Also, the politics has changed. Last year, Trump was in office, and because the Trump administration was supporting the lab leak theory, the Democrats and left-leaning intellectuals and scientists tried to debunk that theory. Now the Democrats have their own government.
Yes.
And the Democrats now realize that the lab leak theory has credence to it. So suddenly we are finding that the same people who poured cold water on the lab leak theory last year are the ones today calling for a full and thorough investigation of the possibility that this virus leaked from the Wuhan Institute of Virology. Imagine if the virus, such a lethal virus, had escaped from India or from any other country. That country would have been in the international doghouse.
Oh, absolutely.
But China thus far has gotten away with creating this globally disrupting and paralyzing pandemic.
I'll come to, China getting away, as many say, with murder in just a moment. But Einar Tangen, will China give access for the whole truth to emerge, sir? The WHO members and team members said they did not get full access to data and information when they visited Wuhan.
Well, I think you've put a lot of assumptions into your question that basically that you've already decided that China is guilty before any evidence has been presented. If you actually look at the statements that were made by Fauci, they were an about face. But, there's this issue of the $600,000 that was used over a number of years to do research on spike proteins, which I'm sure Dr. Ambani can talk a little bit about. That is not the same as gain of function. So they're denying it. This idea that somehow Dr. Fauci, the WHO, there's Peter Daszak, and the Chinese were weaponizing this together is a wild conspiracy theory. And you can believe
that
what
as
you
it
want,
may,
but
sir.
the facts are the same.
I asked you a very specific question.
Not as the case.
The World Health Organization team, members who visited Wuhan, said they did not get access to data and information that they sought.
That is correct. They asked for information about cases that had been previous. They asked for information about, in months before. They said that there were some cases involving respiratory distress, and they wanted to know what the diagnosis was, whether any tissue examples, etc. The Chinese said that they did not have that information. They did not say they wouldn't get it. But there's been some real concern in China that, the media, such as yourself, have already prejudged the situation, and that you take anything that is said as an admission of guilt. If the table was turned and China was doing this to India, you'd be outraged. And quite frankly, I mean, there are plenty of things to be outraged about. This, the fact that you're quoting Donald Trump and Pompeo, who did their best to pretend that the COVID-19 virus was not something to be worried about, that America was prepared. It sounds to me like many governments in Brazil, United States, and even India are interested in finding a scapegoat for their rather
Had truth emerged, there wouldn't be a need to look for a scapegoat. And we'll go on specific facts.
Emerged, sir.
So
you
here,
can say all you want.
We are
about
sincerely
truth,
only
but
on
you are not
facts
speaking
in our
the truth.
Tangen.
You are simply
And let me bring in Dr. Anand. Let me bring in Dr. Anand purely for facts. What kind of data would scientists be looking for to establish the truth? A microbiologist, Dominic Dwyer, he was a part of this WHO team. He told journalists that the WHO team had requested for patient data of early cases. And he said this is standard practice anywhere in the world. The same was denied to them. So what data would scientists need? And can China get away by saying that we don't have such data? They only have summaries of cases and not the cases themselves.
Well, I'm very confident that Chinese medical facility is very advanced. And I don't think they do not have a way of data managing and data keeping. So they should be having it. It will be very unfortunate if they do not have those data. And if we get data for those early cases, you might have seen that in, I think yesterday and day before, there were these reports that there are several cases which were dating back to November 2019.
Yes.
So if we get information about those cases and what kind of disease those researchers were having, those are definitely going to be a very strong evidence in terms of understanding whether it's a lab leak or it's the theory that we are looking into, that the origin is from wet lab. So those data is going to be very important. And I'm very confident that Chinese science is very advanced. They have all the necessary tools and technologies required for data managing and keeping. So I hope they provide the data. And so that is one very important thing. And then what we are trying to discuss over here is that in early 2020, we were not following the advanced or standard scientific process.
Okay.
Where we keep all the theories and hypotheses open unless we have strong evidence to rule out that hypothesis. But
that evidence would only emerge from data, from information that China appears to be prima facie denying, a charge that, of course, China denies. But Professor Chellaney, China says it gave summary of details of initial patients. Is that enough? Is that perhaps smacking of a cover-up? If you remember with SARS, there was information that it emerged from a bat to a civet to a human being. So there was a chain, there was a transmission. With MERS, it was bats to camels to human beings. We still don't know about coronavirus.
Well, if you look at SARS, it's an undisputed fact that SARS originated in wildlife, right? That has been well established, but there is no conclusive evidence that the COVID-19 virus originated in wildlife. In fact, there are two aspects of this virus which strengthen the theory that it originated in a lab. The first is the fact that the virus from the very beginning has been well adapted to indoor transmission. Animals, as you know, live generally outdoors. So if it came from animals, it should be easily transmissible in outdoor settings. But this virus from the very beginning has been adapted to indoor transmission, and outdoor transmission remains rare even today.
Yes.
The second aspect, as Robert Redfield, who headed the CDC in the US, said, that in normal circumstances, a naturally occurring virus takes a while to figure out how to become more and more efficient. But this virus, the COVID-19 virus, has from the very beginning been efficient in transmission. From the beginning, this virus has been transmitting efficiently across all geographical and climatic zones, regardless of ethnicity, race, gender, and age. Now, these two aspects give credence to the theory that this virus originated in a lab, not as a weaponized pathogen, but as a virus that escaped accidentally from the lab, because that lab in Wuhan, the Wuhan Institute of Virology, by its own admission, was working on bat coronaviruses. It was engaged in gain-of-function research.
Yes.
It was turning these viruses, re-engineering them into more infectious and more dangerous viruses.
Juicing them up to become more dangerous.
Such research, they have published papers, scientific papers on their research. So an escape from the lab is something very possible.
Mr. Tangen, eminent science writer Nicholas Wade writes, with SARS and MERS, it was known in a time period between 4 months to 9 months, the route that the virus took from bats to human beings. But even after 15 months, there is no clarity on COVID-19. And then comes this question, is the truth being hidden at a lab at Wuhan, sir?
Well, no, the Chinese have said categorically that they were not doing gain-of-function research on COVID-19. I mean, anything related to COVID. They were doing And as Dr. Ambani said, there's a real correlation between bats and these diseases, not only this, but many other ones, and their transmissibility through it. So if you didn't do the research, you would be negligent in the extreme. So the fact that they're doing research does not mean that they're weaponizing it. The fact that the U.S. is sponsoring part of it doesn't mean that there is a grand conspiracy. I mean, you keep saying there are questions, but that does not equal there are, facts. I agree, and I think it's important for everybody to find out exactly how this was transmitted. But in many cases, it's forensic pathology takes time. And even when you have the best of circumstances, you don't know exactly where it is. Now, we can talk about this, but if the fact is we are at a point where people around the world are suffering, and there have been many variants, some in India, some in South Africa, other places. And these have adjusted very, very quickly. So the previous speakers, it's not very scientific idea that somehow this was bred for indoor exposure. And therefore, it has to be some sort of plot is not plausible.
If China were to come clean and put forward facts in public domain,
sir. You keep saying,
we would know that there is merit in what you're saying, sir. But Dr. Anand, Wuhan Institute of Virology is a BSL, a level 4 safety lab, the highest level of safety, at least on paper at Wuhan. If there is a lab leak, as some suggest. So, Mr. Tangen, it's not about weaponizing just as yet the kind of information that's available that seems to indicate perhaps it leaked. The point that you were making, Dr. Anand, some researchers sought medical help before this information became public in November 2019. The assumption remains it's a leak, and China must come out with facts about these patients and 174 others that the World Health Organization sought information about.
All of the learned papers that were peer-reviewed.
Dr. Anand, Mr. Tangen, with your permission, Dr. Anand first. Go on, Dr. Anand.
So what I'm saying is, gain of function study in microbes is a very powerful way of studying and being prepared for whatever kind of problem we may foresee.
So give me a moment as I try and reestablish our audio link with you. But Professor Chellaney, will truth emerge? The world wants facts. China says we don't have those facts. The world is also heavily dependent on China, whether it's for medical aid or other supplies. Are we then looking for facts perhaps then a pipe dream, sir?
I think the pressure is building up on China to come clean on the origins of the pandemic. There's also another reason why the genesis of the pandemic needs to be thoroughly and fully investigated. The fact is that this is not the first deadly disease to spread globally from China. A number of influenza epidemics have originated from China. This, they include the 1957 Asian flu, the 1968 Hong Kong flu, and the 1977 Russian flu. This is all according to Chinese scientists, that these influenza epidemics originated in China. And according to new research, even the 1918 Spanish flu that killed 50 million people worldwide originated in China. Nor is the current pandemic the first China-originating coronavirus pandemic or the first case involving Chinese concealment of facts and samples. A Chinese cover-up of the SARS outbreak triggered the world's first 21st century pandemic. The cover-up of SARS is well documented. Similarly, the Chinese cover-up of the COVID-19 origins is also well documented. We know how they went after the doctors and whistleblowers, how they suppressed all information about the outbreak in Wuhan, how they allowed a local outbreak from becoming, how they allowed a local outbreak from becoming a global pandemic that still is a global menace. China is culpable from the very beginning, from the time the outbreak began in Wuhan. The suppression of even basic information led to a local outbreak turning into a globally paralyzing pandemic.
It indeed did. And Mr. Tangen, if China has nothing to hide, why not share the raw samples? Why not share the medical reports of 174 initial payments? China should be equally interested in the truth emerging and, as Dr. Chellaney says, as Professor Chellaney says, in clearing its name.
Well, I mean, Professor Chellaney has uttered a string of falsehoods. It would be almost, it would take quite a while to refute them. All of this stuff about the Spanish flu, the Russian flu, all coming from China, it's nonsense. He's simply repeating these things is an affront to his intellectual capacities.
No, but the fact remains, we are simply on facts. Mr. Tangen, I asked you, the World Health Organization wants raw data.
So
China is not providing raw data. How is that deviating from facts?
And say, where are the factual bases for these alleged studies that you have? In terms of finding out what the case is, I have said repeatedly, I think it would be very good to have as much as a forensic study as you can get. But simply saying that China is trying to suppress
China will have to provide access and raw data that China refuses to do, sir.
Of this
well, Gaurav, if you have
your country is not.
Chinese Communist Party on your show,
I mean, it sounds like
Chinese propaganda. And this is the unfortunate part. You are getting just
you're the only one who's uttering propaganda
that the Chinese Communist Party dishes out.
Oh, but on India Today, we ensure facts emerge, and we try to ensure that truth emerges. And perhaps Mr. Tangen would want to come back to us at another date, because I'm running out of time on this show. Why is China not sharing information with the World Health Organization? They sought original medical papers of 174 people who tested positive, and this is the WHO report. Sir, I leave you with that question to Dr. Anand, Professor Brahma Chellaney and Einar Tangen. Many thanks for joining me here on India First. A quick break, an exclusive conversation with Dr. Naresh.